What to expect in your first appointment for your women's health physiotherapy. So number one, what are we going to talk about? So number one, we'll get a good history of what your symptoms are and a good idea of what your bladder and bowel habits are. So an idea of how frequently, how urgent, any leakage or any triggers for your urgency, and get a good understanding of that. Nextly, we'll have a talk about what is your childbearing history. So how many children have you had? How many times have you been pregnant? And how were your children delivered? And were there any extra interventions to help baby out on their way? Number three, we'll have a bit of a talk about, well, what type or how much physical activity are you doing per week? And get a good understanding of what is your physical conditioning and fitness like. We'll also have a bit of a talk about your hydration and your nutrition, as that can give us a good indication of what may be contributing towards your symptoms or how we can help there. And lastly, we'll have a bit of a discussion about what are your goals and your expectations for physiotherapy as well. So where are we trying to get to and what are we trying to achieve? All right, now what will we assess in the session? So we will look at your pelvic floor function and strength, and that might be using our ultrasound machine like the one I have here, or it may involve, if indicated, a vaginal examination as well. We'll also have a look at your global strength, so your strength of your abdominal muscles, your hip muscles, and also your lower limb muscles, and see if there's any deficits or differences there. And we'll also have a look at your bladder diary as well. So we'll ask you to complete a bladder diary before you come into your appointment, and that will give us an idea of what are your current bladder and bowel habits, and we can see if we can see any patterns emerging there. And lastly, what will you walk away with after your first appointment? So after your first appointment, you'll have a thorough and good understanding of what your condition is or what your problem is and how it's going to be managed through physiotherapy and with the aid of any other health professionals or services there. You'll have an individualized pelvic floor strengthening program, which we would have prescribed through the use of the ultrasound machine here. You'll leave with a good extensive repertoire of urgency management strategies, so you can figure out what works best for you, and you'll also have a really good idea of what are good bladder and bowel habits and how can you improve in that department. And lastly, you'll leave with some advice on how you can still maintain your physical activity levels despite the symptoms you're experiencing, and how you can improve your physical activity levels if you're not currently physically active. And that's a very important part of treating pelvic floor dysfunction. Stay tuned for tomorrow's video, where I'll be going through what is a bladder diary and how you can fill out a bladder diary for yourself. Have a great evening, guys. Thanks.